Hearty good afternoon to everyone. Hello and namaste. Welcome to our session on postpartum core muscle weakness, pains and aches, and getting back to fitness. We're pleased to have Dr. Aditi Singh here, and she's one of our expert in-house neurological physiotherapists, and she's going to be enlightening us on the topic at hand. Thank you, Doctor. You can begin.
Thank you so much. Thank you so much. So, I've done my specialization in neurophysiotherapy some 17, 18 years ago. But for a long time, I've been working in women's health, and now I am a pelvic floor physiotherapist, a very few professionals in India, and I'm associated with Apollo Cradle in Janagat, Bangalore. So I am in this branch of Apollo Cradle. It's still on. Yeah. So today now I will be taking you through like what happens during your pregnancy to your core. So the topic for day is postpartum core weakness. To understand what is postpartum core weakness, let's understand what happens during pregnancy. So, okay, pregnancy, everybody knows it's a special condition, it's a physiological condition, there is no pathology involved. But pregnancy, as such, causes a few malalignments in the body, postural malalignments in the body. A lot of muscles they get stretched out. Almost all the ligaments in the body they get stretched out. Almost all the joints in the body they get loosened up. They become more hypermobile because they overstretch, and this all these things are happening so that the woman who's bearing the child can prepare. So body is preparing the body of that woman to bear and to deliver in a normal, very natural way, which is vaginal delivery. So all the moms, they want be able to train your body more mindfully, that when the baby is coming out through the vaginal canal, your pelvic floor muscles, which are down. So this is the pelvic model here. Yeah. And this is your pelvis. This part here is your uterus, fallopian tubes, and this part is your bladder. Yeah. So now baby grows here in the uterus. Yeah. So initial 1 to 2 month baby will be growing inside the pelvic cavity, but over the period of time till you get delivered, the baby expands. So the uterus expands up, uterus goes down, and uterus also expand the belly forward. So when this expansion of the uterus happening in somewhat like 3D dimensional pattern, where the belly muscles have to stretch out forwardly. Yes. So these muscles they stretch out a lot, which causes lengthening of these abdominal muscles happen anteriorly. But what happens to the posterior part, what happens to the area where you have your low back and the lumbar spine, muscles they shorten up. So it's a mechanical imbalance which is happening in the body, or more lengthen, but your hip flexors, the front muscles of your hip, it becomes more tighter, just to balance out. Your both the sides, so you have some muscles on the side here. These muscles, yeah, so these side muscles, you have the muscles name is quadratus lumborum, which we call as QL. You have on the other muscles like internal obliques. They also tend to get, one side is more tighter than the other side, just to accommodate the growing weight and the growing size of the uterus. So when your anterior abdominal muscles are going into hyper lengthening, then what is happening? There's a structure at the center, yeah, which runs through the breastbone down, which is your sternum, down to the pubic bone, a thin aponeurosis that is known as linea alba. It thins out. So the collagen within your anterior muscles of your abdominals, they are not tight, they are much more loosened. So more advancement in pregnancy happens when these muscles are becoming more loosened out. Yeah. So when they are becoming more loosened out, they are spreading away, lateral spread. So they open up. So it very very subjective that how much opening in the front is happening. So that opening in the front is known as diastasis recti. Yeah. So diastasis recti is the gap which occurs during pregnancy, which stays in many women post pregnancy, postpartum. In many women, it heals by itself, that your abdominal separation is coming to close. Yeah, it closes. And for some women, it stays. And when it stays, it causes a lot of biomechanical imbalance in the body. Yeah, that is first thing is happening. Yeah. Now the second thing, what happens when this all expansion of your abdominal cavity is happening, along with that, as I mentioned, that uterus not only grows forward, yes, it goes up. So it goes up and it pushes your diaphragm. So now your diaphragm is not able to contract. So when you want to inhale, what works? Your diaphragm works. Yeah, so diaphragm is your main inspiratory muscle, which is sitting like this. So these are your lungs on top, and down is your abdominal cavity, and this is the baby which is pushing the diaphragm up and down. So this is the way should happen. So when you want to inhale, diaphragm must contract. But when the baby is right here, these contractions are not happening. So your diaphragm muscles, they become tighter. Along with that, your muscles which are over the lungs, over your rib cage, yeah, intercostal muscles, both internal and external intercostal muscles, they also undergo tightness. Along with that, your lung capacity is not the same as it was, few months or few days ago. So there is a lot of tightness happening there, and because of increase in that lumbar lordosis at your low back, which is, you are going forward, you're pushing, your belly is pushing forward, your shoulders, they go round. So rounded shoulder happens. These are the postural things which are happening. Now, as I also said earlier, that your baby is not only pushing forward and up, it is also pushing down. So down where it is pushing on your pelvic floor muscle. Yeah. So this is your pelvic floor muscle. This is the floor of the pelvis. It's a very resilient structure. Yeah. And it's a muscle. It's a muscle. So it is a muscle which is holding the baby. Your vaginal canal just cannot open to push the baby out, because labor takes, it's a process, right? So now this muscle is holding. Now, because the weight of the baby is pushing this muscle down, this muscle lengthens. It is also stretching because of the natural delivery of the baby. Yes. So now the pelvic floor muscles, they are also lengthening for the natural delivery of the baby. Yes. So now the pelvic floor muscles, they are also lengthening down. But because this the same muscle is holding the baby, along with lengthening, this muscle undergoes a lot of tightness. Now, why you need to know? Because if you are already pregnant, you need to understand about this specific particular pelvic floor muscle, and this muscle is already tighter, so it is lengthening and it is also causing a tightness. It is undergoing spasm because it is holding the weight of the baby. So first thing you must be avoid doing when you are pregnant, in your pregnancy, stop doing Kegels. So Kegels might be good for some people, but for some people who have tight these muscles, tight pelvic floor muscle, if you keep on doing Kegels, it will make your pelvic floor muscles more tighter. Yeah, you need to lengthen the pelvic floor, relax and contract. Kegels mostly focuses on contractions, pulses. When we talk about the postpartum core, and these muscles are getting weaker along with the other muscles also, which is the reason of next point we come to pains and aches for today's topic. So when you have muscle imbalance, pains and aches can come if you are not very mindful in maybe doing exercise, or maybe doing your daily, household chores, or any physical activity, maybe walking if you want to walk, or maybe if you are doing weights during a pregnancy, which is completely allowed if you don't have any complications during a pregnancy. But you need to be very mindful about your postures. So if you have good posture to exercise, to begin with the exercise, you can reduce the pains and aches. But without doing anything also, you might have pains and aches. Now, pregnancy-induced pelvic girdle dysfunction is one term which I think all the pregnant ladies must know. So where what happens, there are specific point in the pelvic girdle. This is your pelvic girdle. This is the pubic bone. If you are suffering from pubic bone, bone pain, or if maybe you're suffering from tailbone pain or pain on your dimples on the side. So this SI joint is known as, I think it's turned off. No, it's okay. Going on, sorry. So this is your sacral dimples. Dimples at the back, which we know as sacral dimples, down at the back of the thigh, back of the knees, till the foot. It could be the symptom of sciatica, something like this you are suffering from, or if something like this you're suffering from upper back pain or shoulder pain during pregnancy. I think you must check with your doctor to refer you to a woman's health physio or a pelvic floor physio who knows about pelvic girdle dysfunction. So these are very common things, but many a times it happens that you feel it's like with pregnancy and it might go with pregnancy. But I will tell you right now, this pelvic girdle dysfunction, which is happening because of the dysfunction in the pelvic girdle, it most of the cases it doesn't go after child delivery. According to researchers, it has seen if you are suffering from pelvic girdle dysfunction or pains and aches in the pelvic girdle and you deliver the baby through vagina, it increases the pain. Many a times it is seen that it increases the pain. Irrespective of vaginal delivery or C-section, most of the cases we have seen that, or it's given in the research that pelvic girdle dysfunction, pains and aches, they or a woman's health physio in your city. If you are in Bangalore, I am here in Apollo Cradle. I would be able to see you. Yeah. Now, getting back to fitness is the third point of our today's discussion. So, getting back to fitness has a very important role, or I can say the physiotherapy has a very important role when you get back to fitness post child delivery. So, for an instance, if you have knee pain, right, you go to your orthopedician. Your orthopedician refers you to a physiotherapist. He says, okay, get sorted with your pain first, and then you go back to your exercising. Let's take an instance for some a heart problem you have, or it could be maybe, I'm not talking about maybe open heart surgery, but any heart related or lung related issues you have, and you're not able to exercise because of that. Yeah, you're not able to breathe, you're not able to exercise. You go to your cardiologist. Your cardiologist refers you to a cardiac rehab, to a physiotherapist. Then physiotherapist undergoes with a series of program with you, and then when you are fine, physio tell you, okay, you go and hit the gym now. The similar thing happens in women who need that physio. Anytime after 6 weeks to 8 weeks, when you are fine, when you feel fine, that is a time that, okay, you go and hit the gym now. The similar thing happens in women who need that physio. Anytime after 6 weeks to 8 weeks, when you are fine, when you feel fine, you must check with a pelvic floor physio. You must get yourself assessed thoroughly. And once your pelvic floor physio mentions some kind of rehab program, yes, and after that you are fit to go to a gym. Now, what kind of symptoms you should be having to meet a pelvic floor physio? So there are no symptoms to meet a pelvic floor physio. The only symptom and the only reason that you are meeting a pelvic floor physio, that you have delivered a child. Now, delivering a through your vagina, it is a trauma to the pelvic floor muscle. If you are delivering a through your vagina, it is a trauma to the pelvic floor muscle. If you are delivering a baby through C-section, it is a trauma to your anterior abdominal wall. Yes, and then you might feel body is amazing. Yeah, body is very resilient, body is amazing, it will heal you. But you might have some adhesions. You might have some adhesions within your different layers of abdominal muscles. You might have adhesions within the pelvic floor down there. And specifically, if you have been undergone any perineal tear during vaginal delivery. So what is perineal tear? The tear happens between the vagina and the anal sphincter. So your doctor can put an incision there, which is known as episiotomy. Yeah, so to allow the head of the baby to come out, and then they suture it. If they're not doing that, many a times the pelvic floor muscle, that perineum part of the pelvic floor muscle, it stretches and it just goes, it breaks from there. Yeah, it tears from there. from there trauma, then you need to be aware of certain signs and symptoms. And these signs and symptoms are very similar to the signs and symptoms of any pelvic floor dysfunction. Yeah. So what are these signs and symptoms? The first and foremost sign is any kind of involuntary urinary leakage. So what happens? What is involuntary? Involuntary means it's not voluntary by you. So your urethra, which is right here, yeah, it has voluntary control. Means when your bladder is full and maybe you are in a moving bus or maybe you are in a meeting which is just not getting over, you have the control over your sphincter to hold it tightly. Yeah. And then whenever you are ready, you go to the bathroom and releases. That is voluntary control. What happens in urinary leak? That this sphincters which are voluntary, they are not working voluntary. So you leak out. When you leak out, sneezing, it causes a lot of pressure within the abdomen. Coughing, jumping, so jumping jacks, skipping. If you are exercising, many ladies, they come to me, they say I'm jumping and skipping and I'm leaking. Yeah. Weight training, heavy weight lifting, it also causes the urinary leak. If you are also experiencing something like that, meet a pelvic floor physio. Your pelvic floor muscles are not working properly. Second symptom is you are not able to control the gas at the back passage. So this is your anal sphincter here at the back. So again, it's a voluntary control. So you are aware that when you don't want to release the gas, you are aware that I don't want now. Yeah. But if that voluntary control is not there and you just reasons of the fecal incontinence type of thing, and any kind of trauma to the pelvic floor in general first translates to urinary incontinence. What could be the other dysfunctions of the pelvic floor muscle is the sexual dysfunction. Yeah. So after baby, you are still not intimate with your partner. You feel pain down there. You feel that you might be having stitches down there, maybe because of the perineal tear or episiotomy. Those stitches are still hurting you. Many ladies, they feel that during the periods also they have the pain there which was not there earlier, and the sexual penetration is again causing the pain. So it will not go. So you can wait maybe for a month, 3 months, 4 months, 6 months post delivery, but if still persists, I think again you should meet a pelvic floor physio. Now, how this is all related to fitness, which we are talking about, because fitness is so much important post delivery when we are talking about the pelvic floor muscle, because these muscle is one of the muscles of the core compressor muscles, which is the part of your anterior abdominal wall. So now if your core healing is not happening the way it should happen, then getting back to fitness may cause all these symptoms like incontinence, like perineal pain, like any pelvic pain, or it could be low back pain. So you feel that I have the strongest abdominal muscles. It's like 6 months or 1 year post delivery, but I feel that I am very strong. My abdominal muscles are very strong, but I'm still suffering from low back pain. Why it is? Or I'm suffering from hip pain. Why it is? Or I'm suffering from pelvic pain. Why it is? It could be the reason that your still core instability is not proper, or it could be that you might be suffering from pelvic girdle dysfunction. So until we check it you personally, it's very difficult for us to tell you, okay, this is the issue. Yeah. So getting back to fitness, things to avoid is give yourself time to heal properly. At your 6 to 8 weeks post pregnancy, meet a pelvic floor physio to understand if there any issue with your pelvic floor down there. Third thing, take your time and start slow. So many times I have seen that many ladies suddenly feel, oh my god, 8 months, 1 year post pregnancy, my belly is still so big and I'm not able to reduce it. So what you do is diastasis recti, which I have told about it initially, that you might have the abdominal or belly separation. Yeah. So that time we need to understand how to heal the core, how to connect with the core, and not do any excessive exercises which are causing an increase in intra abdominal pressure. Yes, so those things we need to avoid. So take it slow, go slow. If you have any pains and aches, connect with your pelvic floor physio, ask your gynecologist, ask your doctor to refer you to the pelvic floor physio. uh, Take it slow again. And in case of any pains and aches, you might start with, at home conservative management like hot pack, or if the pain is so severe, you can have a painkiller and see if the pain is going in a day or two, in a week's time. But more than that, then I think you should consult someone. So there is one more thing when we talk about core. So when you are delivering the baby through your vaginal canal, your pelvic floor muscle usually heals up to 80% within 6 to 8 weeks time. So that is the time that we also want that your pelvic floor muscles should heal around 80%. If you come for the assessment to us, then we will heal till you are 8 to 10 weeks postpartum. So your abdominal muscles take a lot of time to heal as compared to the pelvic floor muscle, but it also depends very subjectively. What you do, what is your profession, uh, what is your lifestyle, how much you are physically active after childbirth. There's so many things are there which goes in, but yes, the healing takes place like that. Also, there are a various myths associated to postpartum fitness, like you should only start with the abdominal crunches. No, you should not start with abdominal crunches. You should have the whole body workout if you want to reduce that weight, the pregnancy weight. So whole body, there is no spot reduction, there is no isolated reduction. It has to be overall workout. But yeah, some areas you need to work harder than the other areas. Second thing, the abdominal binders or the abdominal belt. So abdominal binders and abdominal belts are not to strengthen your core muscles or not to make your belly muscles flat. So if you are using these, they will resolve the muscles which are have separated, right? So it will just become closer and it will promote healing. So other than promoting healing and giving you a comfort zone that okay, you are having a support at the lower lumbar spine, which is also supporting your pelvic area, it's only a very psychological thing to give you support and bring your muscles closer. But how to reduce your belly fat and how to bring that mummy tummy down is your exercise and mindful eating. One more myth here is you just go to the gym and start doing the training. No, if you have any specific issues which I've already spoken about, right, then I think you must check yourself. Get a consultation with the pelvic floor physio. Let that person, let her check on you, like what are the difficulties, what we are looking at, what is the evaluation. So what we do exactly, we do per vaginal evaluation of your pelvic floor muscles. If you have specific pelvic floor symptoms, yeah, our per vaginal examination is very different from going to check the neck. We also check if you have any tenderness inside, if you are hypersensitive inside, if you are hypersensitive inside for some reason, specifically if you are suffering from, some kind of pain down there. So we need to check that tone. We check your posture. So this is the on palpation. We check your pelvic floor. So we also check what kind of activities you are doing. So if you're maybe doing squats or lunges, we make you do, and we want to understand that how you're doing these activities. Is your posture right? Are you doing in the right form? Yeah, and are you doing the correct amount of repetitions? Are you using the correct amount of weight? So that's what we do in pelvic, pelvic floor examination. If you want to visit a pelvic floor physio for the examination of your abdominal wall because you feel you might have diastasis recti, that time we just check how is your muscle tone of your abdominal wall. If you have a lot of looseness, sagginess, maybe then we just to come to know maybe your collagen is still not binded together properly. We also check how many fingers gap you have. We also check if you have a coning is a thing where your bulk happens. So that is also a thing which we check. these two layers of the muscles are there. So coning. So when you're doing any exercise, specifically crunches, you feel that coning is happening. That you feel that something is coming out in between the two layers of the rectus abdominis, or those six packs you are doing. So these are the things I wanted to cover in today's session to tell you that postpartum core weakness heals by itself. I also gave you the timeline, but it might not heal completely. And then where you should go, do not hit the gym directly. Give your body time to heal, maybe 3 months to 4 months. If you still feel no, something is wrong, I've started doing some exercises at home, no, you then meet us. Second point, I have covered pains and aches. If you have pains and aches which you feel they were there during pregnancy, now they are there post pregnancy, they are not going away, I'm not sure what to do, again meet a pelvic floor physio on that. Yeah. The third thing I was discussing about getting back to fitness. If you want to get back to fitness, you need a consultation with the pelvic floor physio to understand what is going on in your body. So we check your pelvic floor, we check your abdominal wall, we check your posture, we check the general strength you have in your body, we check how you do what you do, yeah, the movement, and we also check your functional movement and functional pattern. Yes, so this was it in today's session. And also I was talking about that you should not be too soon is really not good for to start with exercise till 6 months. Full time lactating, breastfeeding mother, till 6 months full time lactating, breastfeeding mother, then you should have some kind of ergonomic mindfulness in your in your mind, that how you should sit. And if you don't know, again you can get in touch with one of the women's health physio, would be able to tell you how to hold the baby when you want to lactate and feed, so that you are not having that upper back pain and low back pain every time you want to feed the child. There are some basic exercises which you can do sitting on the chair when you are breastfeeding. So you can check out, I'm on Instagram. My Instagram page is dr.aditi.singh.pt. I'm repeating it, Dr. Dr. Aditi Singh.pt. And I have some exercises for new moms, breastfeeding moms. You can sit on the chair and you can do some exercises, so that you are just going on with some movement and it's not very stagnant. Yeah. So do check out my Instagram page. I am very much active on Instagram. I talk about a lot, many things about pelvic floor and signs and symptoms and pregnancy exercise and post-pregnancy exercise. Last point I want to cover, right? So when the baby is not there, there is no need that the diaphragm should be stuck up. Diaphragm should be able to contract nicely. So the basic deep breathing exercise should be encouraged. As soon as you deliver the baby. C-section or natural delivery, day 0, you can start with deep breathing exercises. So diaphragm is stuck up like this, right? You need to contract it. Watching me here. And yes, thank you. Thank you.